These are cups that are commonly used in acupuncture practice. They're used, again, for instrument-assisted soft tissue manipulation in a traditional way by applying suction to the surface of the skin and either leaving the cups in place or applying that suction and a little bit of a lubricant to the skin as well, and then moving the cups back and forth once the suction has been established. These are, again, traditional cups, fire cups. I will show you how they're used. We will use our practice pad and the small cup. These are 3 sizes here, small, medium, and large. They come in other sizes. There's an extra large. There's also extra small cups for different applications. If I take the small cup, there are a few standard ways of creating the heat. So they're called fire cups, not because there's any fire that gets to the patient, but we put some fire inside the cup in order to create heat, and then we place it on the skin, and the heated air then contracts quickly and creates a suction. By putting a little bit of alcohol in there, wiping the inside with an alcohol swab perhaps, and then touching a lighter in there, it will cause a little puff of flame, and then it will heat the air, and you can place this on here. However, if you just use a barbecue lighter and you get a little technique down where you do this quickly, we can easily then create suction. And I don't know if it can be seen on the video, but there's a little bit of suction here, which is holding this cup fairly tightly to this practice pad. Now, to release the cup, we just put a little pressure on the side, and the cup lets go. Again, these are fire cups, and they're quite commonly used for doing cupping in Chinese medicine. There are other ways that we can create that suction. There are glass cups and plastic cups that are made with a valve on the top, and there are various suction devices, pumps that can go on the top so that you can put the cup on and just pump the air out of it. Some people like those. One thing that I would caution you about is when purchasing cups to be cognizant of the size and the thickness of this lip, because if this lip is very thin, it makes the cup uncomfortable, especially if you want to slide it on the skin. If it's a very thin edge, it can feel almost cutting or scraping, whereas this is much more comfortable for the patient. The type of cup that I particularly like to use now are these silicone cups, and we can see that silicone cups are much easier to use. I'll take the small one here. They also come in a variety of sizes. You can even see that there's a little bit of smudge on the top of the practice pad, which came from the heating of the air in order to put this cup on. So this will avoid certainly that problem, but it also takes the whole fire out of the picture. Simply by squeezing the silicone cup, we can create the suction. We squeeze the cup, we set it on the skin, and again, it creates suction. And you can perhaps even see that this is even a much stronger suction than we got from the glass cup. So these are very useful. Again, remove them in the same way, just by touching the side of the skin, letting some air in. But I think between either silicone cups or glass cups, or if you prefer, some cups that are used with pumps. Either way, they all seem to work the same, and we'll demonstrate their use on a live model at another point in this program.